Now the question is, you take this drug, you take Prozac or an SSRI, how does it change your brain? Because what we've found so far is that prior to going on the medication, you don't have any known abnormality. Your brain, as far as we can tell, is normal, right? But the drug is going to change your brain. And then there's even some sense it may change your brain permanently. Okay? Now, I'm going to go back to the antipsychotics because it's in the antipsychotics that have been done the most research on how the drugs change the brain. But then we'll get into the SSRIs. This is just a diagram of how a dopaminergic neuron happens before you go on the drug. So you have a presynaptic neuron. You'll see like 4 receptors on the receiving neuron. You'll see the little black dots are the dopamine it binds, okay? Now think about this. What an antipsychotic is going to do, it's going to sit in those dopamine receptors. It's going to gum up that lock, okay? So now dopamine can't bind with those receptors. It's acting as a brake on dopaminergic transmission. Now what do we know about the brain? Extraordinarily neuroplastic, right? It's going to try to adapt to the presence of that drug. So if you put down the brake, what do you think it's going to do? It's going to make more of the receptors. It's going to put down the accelerator. Now here's the interesting thing here, is I'm taking this slide from a psychiatric textbook. And think about this for a moment. We find out that antipsychotics work by blocking dopamine receptors in the brain. We hypothesize the problem then is too much dopaminergic activity, and if you follow this story forward, here's what you find. In the 1970s, you find research papers saying, we may have found the cause of schizophrenia. Because in fact, 3 weeks after they put people on medication, they were showing elevated levels of dopamine metabolites in their cerebrospinal fluid. They said, we found the cause of it. These presynaptic neurons are putting out too much dopamine. But then you had to read the paper. They said, maybe this isn't due to the disease, but this is a compensatory adaptation to the drug. And they found out, sure enough, what happens is you go on an antipsychotic, puts down the brake. Now the presynaptic neurons, trying to compensate for that brake, put out more dopamine than normal, and that's why you get the higher cerebrospinal fluid. So once that was understood, then they looked at autopsy of people with schizophrenia, and they counted the density of dopamine receptors. They say, now we've found it. The problem's not with the presynaptic release of dopamine, it's that these people have too many dopamine receptors. We have found the cause of schizophrenia. It's too many dopamine receptors. That's why we have to block them. But then someone said, but maybe this is caused by the drug. And then they looked at people who had been never medicated. They did not have too many dopamine receptors. Then they found a way to look in living patients the density of these receptors through some labeling techniques, and they found out prior to being medicated, they didn't have that. So what they found was this sort of horrible fact. The drugs induce the very change in biology hypothesized to cause schizophrenia in the first place. And now as we look at the long-term effects of medications and antipsychotics, you're going to see how that comes into play, okay? But that's what they found with antipsychotics. What did they find with SSRIs? Think about this. SSRIs now act as an accelerator. What do you think the brain does? It's going to put down the brake, right, on serotonergic transmission. What researchers say, these compensatory adaptations are done to try to maintain a homeostatic equilibrium, a normal functioning of these pathways in the brain. So after you go on an SSRI, what do you see? The presynaptic neurons release less serotonin than normal, and the receiving neurons now decrease their density of serotonergic receptors. So again, what was depression hypothesized to be due to? Low serotonin. You go on an SSRI, and in fact, it drives your brain into a low serotonergic state. Okay? Just so you see this is Stephen Hyman. You might want to read this paper. He describes this process. I hope you see that this is not some alternative explanation of what's going on. This is what psychiatry investigating these these theories, this is what they found. So this is a former director of the NIMH. They create perturbations in neurotransmitter functions. That's the blocking of, say, the reuptake or the blocking of receptors. The brain now tries to adapt for that. The chronic administration of drugs cause substantial and long-lasting alterations in neural function. What's happening is if you get a difference in the receptor densities, it means you're changing gene expression. Okay, so that's a fundamental change. There's some thought now that it will be handed down to kids because of epigenetic changes. Sometimes now it looks are inheritable. And what does he say? After a few weeks, the person's brain is now functioning in a manner that is qualitatively as well as quantitatively different from the normal state. So the American public, which has made antidepressants, they take more antidepressants than any other class of drugs, does so thinking they're fixing a chemical imbalance, that they're normalizing agents, when in fact the science shows they're abnormalizing agents. Now maybe this process helps people long term, maybe not, but you can see the whole thing is founded on a, put it mildly, a deception, a misinformation campaign that obviously serves certain interests. So now, as we go forward, we're going to see to ourselves, does this, when you go on this drug that changes your brain in this way, does it help people over the long term? And what are the long-term effects? Once you have this understanding, I think you can understand, you can immediately sense two things. You go on an SSRI. It drives your brain into a low serotonergic state. This is your new balance. This is the drug upping it. This is the, now your brain is in this substate. Now take away the drug when you come off. You see why you might have a problem? Because your brain has become used to the drug. So that's one thing. You're going to see that coming off is difficult. And then the second is, can you see once you conceive of drugs this way why long-term use might be problematic? It's not exactly the best functioning. You know, nature has sculpted our brains to function in a certain way. And the metaphor I like to use is this. When you leave here today, how many of you drove here today? Okay, here's what I want you to do. When you leave here today, put one foot on the accelerator, one foot on your brake of your car, drive like that for 6 years and see how it wears out your car. That's in essence, metaphorically, what you're doing, because you have the drug either putting on a brake or an accelerator and your brain is trying to compensate.